Homeostasis, aldosterone, Thymus gland, hyperglycemia. Chapter 12, Key terms. Hormones, melatonin. Homeostasis, aldosterone. Thymus gland, hyperglycemia. Hypophysis, hypothalamus. Infundibulum acidosis. Adrenal gland, alpha cells. Beta cells, chief cells. Insulin, androgens. Ovaries, testes. Chapter 12, Endocrine system. Anatomy and physiology. Chapter 12, Endocrine system. Introduction. Purpose: works closely with the nervous system. Homeostasis, maintaining the body's internal environment within certain narrow ranges. Involves growth, maturation, metabolism, and reproduction. Works closely with the nervous system. Hypothalamus sends chemical signals, neurotransmitters, to the endocrine system. Endocrine glands. Ductless glands that secrete hormones directly into bloodstream. Hormones. Negative feedback loop. 3 chemical categories. Mechanism by which hormones function. 3 chemical categories. Modified amino acids. Protein hormones. Steroid hormones. Hypothalamus controls the pituitary gland, infundibulum. Funnel-shaped extension from hypothalamus to pituitary gland. Produces chemical signals. Releasing hormones. Releasing inhibitory hormones. Endocrine glands. Pituitary gland, A. Thyroid gland, B. Parathyroid gland. Adrenal gland, C. Testes, D. Ovaries, E. Pancreas, F. Thymus gland, G. Pineal gland, H. Pituitary gland. Also known as the hypophysis, and also the master gland. Divided into 2 lobes. Anterior pituitary gland. Posterior pituitary gland. Anterior pituitary gland. Growth hormone, GH. Stimulates cell growth and division. Stimulates bone and muscle growth. Pituitary dwarfism, result of too little GH. Gigantism, result of too much GH. Thyroid stimulating hormone, TSH. Stimulates thyroid to release its hormone. Anterior pituitary gland. Adrenocorticotropic hormone, ACTH. Stimulates adrenal cortex to secrete its hormone, cortisol. Helps reduce inflammation. Melanocyte stimulating hormone, MSH. Stimulates production of melanin in the skin. Follicle stimulating hormone, FSH. Stimulates the production of sperm in males. Stimulates development of follicles in ovaries. Anterior pituitary gland. Luteinizing hormone, LH. Stimulates production of progesterone and ovulation in ovary. Stimulates production of testosterone in males. Lactogenic hormone, LTH. aka prolactin. Stimulates milk production in a pregnant female. May cause decrease in male sex hormones. Posterior pituitary gland. Antidiuretic hormone, ADH. aka vasopressin. Maintains body's water balance by promoting water reabsorption in the kidneys. Oxytocin. Stimulates contraction of smooth muscles in the uterus. Sometimes given to help induce labor if the uterus does not contract sufficiently on its own during childbirth. Thyroid gland. Consists of 2 lobes connected by a smaller band called the isthmus. Stimulated by TSH from the pituitary gland. Requires iodine to function properly. Iodine deficiency causes goiters. Releases T3 and T4. Contain 3 and 4 iodine atoms. Regulate metabolism of carbs, fats, proteins for proper growth and development. Thyroid gland calcitonin, hypothyroidism, hyperthyroidism. Lowers calcium and phosphate concentrations in the blood. Inhibits release of ions from bones, and increases excretion of ions by the kidneys. Hypothyroidism. Low levels of thyroid hormones. Cretinism. Hyperthyroidism. Too much secretion of thyroid hormones, Parathyroid gland, 4 small glands on posterior surface of thyroid gland. Made of chief cells and oxyphil cells. Releases parathyroid hormone, PTH. Raises blood calcium levels by causing bone matrix to break down, releasing calcium and phosphate ions into bloodstream. Adrenal gland located on top of the kidney's adrenal medulla. Epinephrine, adrenaline, and norepinephrine, noradrenaline. Released as a response to signals of the autonomic nervous system. Fight or flight hormones. Causes a breakdown of glycogen to glucose. Stimulates release of fatty acids from fat cells. Adrenal cortex, aldosterone, cortisol, hydrocortisone, cortisone. Regulates Na reabsorption and K excretion by kidneys. Released by outer layer of cortex. Cortisol, hydrocortisone. Helps maintain blood glucose levels between meals. Synthesizes glucose from amino acids. Cortisone. Steroid, often give as medication to reduce inflammation. Adrenal cortex, androgens, Addison's disease, Cushing's syndrome. Promotes development of male characteristics. Addison's disease. Not enough hormones secreted by adrenal cortex. Causes change of electrolyte balance in blood. Cushing's syndrome. Blood glucose concentrations remains high, causing puffy skin and obesity because of excess tissue fluid. Pancreas, part of digestive and endocrine systems, alpha cells. Secretes glucagon. Raises blood sugar level. Beta cells. Secretes insulin. Lowers blood sugar level. Diabetes mellitus, deficiency in insulin production, type 1, type 2. Previously called juvenile diabetes. Body does not produce insulin. 5% of diabetics. Type 2. Body does not use insulin properly, insulin resistance. Previously called adult onset diabetes. Balanced diet, exercise, proper body weight, testes and ovaries, ovaries, testes. Releases estrogen and progesterone. Promote development of female characteristics. Control menstrual cycle. Testes. Releases testosterone. Promotes development of male reproductive structures and male characteristics. Both controlled by LH and LTH from pituitary gland. Thymus gland, located in the mediastinum. Helps in development of the immune system. Thymosin. Promotes production of T lymphocytes.